Okay, we have gone over the normal cardiac cycle. We've looked at a normal sinus rhythm. We've looked at a normal sinus rhythm that's going faster than 100 beats per minute, and we decided we would call that sinus tachycardia. If it is going slower than 60 beats per minute, we'll call it sinus bradycardia. And now we're going to look at four rhythms. These are called lethal rhythms. Lethal equals deadly. And in fact, if you are in one of these four rhythms, you will have cardiac output will equal 0. Pulse will equal 0. You'll be unconscious. Your cells will be getting ischemic, and they will quickly become necrotic unless we fix the problem. The first of these lethal rhythms is going to be ventricular fibrillation. Okay, we know in a working heart you'll have an SA node up here and an AV down here, and it will send a signal this way, and it'll send a signal down here. The atria will contract, and then the ventricles will contract, and blood will be pushed out of the heart. Unfortunately, with Vfib, what's going on is a little bit different. In Vfib, individual cells down in the ventricle, a bunch of them, all decide, I'm going to be the boss. I'm going to be the pacemaker. And so each one of them goes off whenever they feel like it, which will cause some problems because, like an orchestra, the heart has to work together to push any blood. So if this guy is going off and he's making contractions this way, and this one's making contractions like that, and this one's going up here and down here, and he's going this way, this guy is going all over, and this one is too, and like this, what you end up with is something that looks like our strip over here. And this little pacemaker going off, well, that's this guy. And this one over here, that's this guy right here. And this one over here, that's him right there. They're just all doing whatever they want. This is sort of like the orchestra warming up before the leader, the conductor, gets up in front of them and gives them leadership. So there's no leadership going on. The heart just sits there and essentially it's quivering, which is actually what fibrillation means. Quivering. It just sits there like a bowl of jelly. It quivers. Now the blood that's inside the ventricles is just getting jostled around. It's like it's getting shaken and stirred, but nothing's being moved anywhere, which is why we have a cardiac output of 0. Again, the brain cells will begin to die in about 4 to 6 minutes unless we change this. Heart cells, it'll take about 60 minutes, and they will go from ischemia to necrosis. But after about 10 minutes, in 10 minutes, the brain cells are all dead. So, again, this is ventricular fibrillation. This is what it looks like. Utter chaos. That's another good term for this. Utter chaos. You never know if it's going up or down. And you can see there's absolutely no coordination. No coordination. No teamwork going on. Okay, so that is our description of ventricular fibrillation.